Hi everyone. My name's Lorna Dawson. I'm the health literacy specialist in the North East and North Cumbria health literacy team. I'm going to give you a whistle-stop tour of what health literacy is in this health literacy awareness session. So I'm going to cover what health literacy is, who does it affect, why is it a problem, and what can we do about it. First, what is health literacy? There are lots of different definitions of health literacy, over 200. This one is from the World Health Organization, and they say that health literacy is about being able to access, understand, check, and use information to make choices about health. So it's about being able to get hold of information in the first place, whether that's online, in a library, from your GP. Um, then it's about being able to understand it. So understanding the words on the page, what do they mean? Understanding if you've got an appointment letter, what time is your appointment at? Where do you need to be? Then it's about being able to check it. So is the information that you found reliable? Is it in date? Is it from a trustworthy source? And then being able to use that information to make some sort of choice. And this could be the choice to have a life-changing operation, or it could be what foods you want to put on your shopping list so you have a healthy diet. So those skills, I often talk about them as personal skills, but it's important to know that we as people aren't kind of isolated. We sit within a context, and there's lots of kind of external or outside factors that influence people's ability to access, understand, check, and use information. So there are personal characteristics that can influence these skills. I'm not going to go into much detail about those now because I'm going to talk about them in a few slides' time. Social resources are really important. So kind of, is there a public library where you can get information from? Where if you don't have a computer, where you can access computers and the internet, do you have the money to buy a mobile phone, to pay for data, to get on the internet, to get on the NHS app? Um, Society and the environment also influence kind of our ability to access and understand and information. And it's really important to know that kind of we as healthcare organisations and healthcare professionals are creating that environment. So we're deciding what hospitals look like, we're deciding what goes on the signs. We are creating the information, the words that people need to understand and navigate to. We're deciding what goes on our websites. So we're a big part of the environment that people are trying to access and understand. This isn't necessarily a formal model of health literacy, but I find it really useful to think about health literacy in terms of how we actually share information. This helps us see how health literacy works on a day-to-day kind of basis. So we share information by speaking, by talking to people on the phone, by speaking in person, kind of sharing results. We share information by writing, could be appointment letters, emails, leaflets, posters. We share a lot of information online. So often we'll have a website with information, might be an online portal to book an appointment, could have an app for your service. Um, and then we also share information by giving people signs and directions. So telling people you need to come and see us and this is how to get there, or this is where we're based. This is where this class is based, perhaps. So who is affected by low health literacy? I said that personal characteristics can affect your ability to access, understand, check and use health information. And this is kind of what I was talking about. Um, so there was a study done about 10 years ago now, looking at um, certain characteristics and that would make you more likely to have low health literacy. And the study found that characteristics that meant you are more likely to have low health literacy were things like sex. So men are more likely to have low health literacy, women are more likely to have low health numeracy. Age, so health literacy gets worse or poorer with age. If you're from a minority ethnic group, or if you're born outside of the UK, if English isn't your first language, so kind of language barriers there. If your school grades are lower than expected by age 16, so education levels. If you're unemployed, if you're on the lowest job grade or on an income less than, say, £10,000, more likely to have low health literacy. If you don't own a home, and also if you live in the top most deprived areas of the country, those are signs that you might be more likely to have low health literacy. What the study didn't cover, but what is definitely still affects health literacy, if you have learning disabilities, you might struggle to understand the information a bit more or access it. And also if you've got mental health issues, so kind of stress or diagnosed conditions. So those were the groups of people who are more likely to be affected by low health literacy, but kind of how many people are, or what percentage of people are affected or would struggle to understand health information. This might be more shocking than you think. So in the Northeast, it's about 62% of people, of adults, who'd struggle to understand health information containing words and numbers. So that's things like appointment letters, um, prescriptions, or it could be things like the traffic light labels on food when you go to the supermarket. So every other person is likely to struggle to understand that kind of health information, which is a really massive statistic, a really big problem. But that's actually a trick question, because really everyone can be affected by low health literacy at some point in their lives. So health literacy isn't a number that just stays with you throughout life. It changes depending on the circumstances. If you remember that diagram earlier of like the external things that can affect health literacy and your skills. So you might have a degree, but if you've been in a car crash, you'll be in shock. And the paramedic might be telling you stuff, but because you're in shock, it's going to be really hard for you to take any information on board. Also, different departments have their own jargon. People who work in their field have often been working in it for a very long time. So they know their language and what their kind of special words mean. We can't expect everybody to know everybody else's jargon. So we encourage you to assume that everybody kind of doesn't necessarily know about your subject area. Everybody might struggle to understand health information. So pitch it at kind of a level that anybody could understand. So why is this a problem? I'm going to explore this through three lenses. So I'm going to look at why it's a problem for patients and the public, then why it's a problem for staff, and finally why it's a problem for organisations and the wider system. So, if every other person is struggling to understand health information, why is that a problem for patients and the public? So adults who have low health literacy, and it's not just them, it's their children and families as well, so the people that they look after, they suffer the worst health outcomes in society. So that means they are more likely to die younger. And they're more likely to die younger of preventable diseases. So things that didn't necessarily have to happen. They're more likely to have long-term conditions, and those long-term conditions are kind of going to have a worse effect on their life. They have kind of poorer health behaviours, so more likely to problem drink or smoke, be overweight. They have less healthy behaviors, so things like a good exercise routine, healthy diet. Um, they are less likely to kind of engage in healthy living campaigns. So all those preventative kind of measures, kind of self-care, they're less likely to do those. So obviously their health will get worse. Um, yeah, so and it's crazy that like just words on a page or the words that we choose to speak can have an impact on people's health, but they definitely do. Why is people struggling to understand health information a problem for staff? So low health literacy can affect staff morale. So if you're constantly having to say the same thing over and over again to somebody because they haven't understood it the first time or you thought they got it, and then they come back and they ask you the same questions, that's definitely going to affect your morale, and your satisfaction with your job. Kind of might doubt, am I doing the right thing? Um, kind of, I guess people who like will struggle to understand information, sometimes they can get quite defensive and a bit angry and frustrated. That could get passed on to staff, which means kind of staff are having to deal with more kind of like angry or stressed people, which makes it a lot harder. Um, this can kind of lead to staff sickness, which kind of puts pressure on the staff who are still there. Um, it also affects the quality and safety of care. So if kind of people understand what's happening to them, they can tell you what's right for them, they can tell you what they want. Um, and so then you can kind of like the quality of the care is improved. Um, but kind of if people sometimes there's an issue of consent where people don't understand what they're saying yes to, but they say yes anyway. And that is a massive safety issue. Um, in Australia, they treat health literacy as a safety issue. But there's also a thing around kind of staff have their own health literacy levels too. If we are struggling to understand mandatory training, for example, around infection prevention, then kind of that's not safe around hospital either. Um, and finally, why is it a problem for organisations? Um, It's crazy that words on a page can impact on cost, but it is estimated that low health literacy or the impact of low health literacy costs the NHS about 3 to 5% of its budget per year. So that's around £9 billion, which is an enormous amount of money. As I've said before, it's also a safety issue, and could eventually potentially lead to kind of lawsuits if we've not provided information in a way that people can understand. Um, it also has an impact on services, so they're not used as they should be. People with low health literacy are more likely to go to A&E for something like a tummy bug. It also means that services that might be really good, you might have a poster kind of advertising it or something or a website. If people can't understand what the service is about because it's been explained in language that's too difficult for people to understand, doesn't mean that your service isn't any good, but people aren't going to use it. Um, and also, low health literacy puts pressure on the system. So if people are kind of constantly coming back with the same issue because they've not understood the instructions the first time, those are repeat appointments. People with low health literacy are also more like it's been kind of loosely linked to attendance or not attending. Um, and we have massive waiting lists, so that puts a lot of pressure on the system. And just to summarize here, so we've kind of talked about quite a few of these, but kind of so people with low health literacy are more likely to miss appointments, and that'll affect your organisation with increasing kind of like DNAs or non-attendance, which leads to longer waiting lists. People with low health literacy more likely to take medication incorrectly, medicines. So if you imagine a prescription, it's like take this twice a day. There's kind of words and numbers. That's a massive safety issue. It also might mean that medicine's wasted, because if people don't take it right, they might think it's not working, so they stop. And then they feel like it's ill, they get worse. Sometimes you have to take medication before having an operation. And if people don't take it, then the operation has to get cancelled. And that is wasted cost of medication, wasted appointment time. Some machines cost thousands of pounds to run. There's the staffing, kind of the wages, to staff an operation that doesn't happen. We talked about using services inappropriately. Um, Also touched on kind of people with low health literacy feeling worried or angry, and that being kind of passed on to staff, having to deal with people who were upset. Um, and an important one in terms of prevention. So people with low health literacy struggle to kind of do self-care. And also kind of that will impact on the people that they look after as well. That means that kind of people with low health literacy have to rely more on services for help. Um, and so again, that puts pressure on services. So that all sounded quite doom and gloom, but we're going to look at how to make things better. So one of the ways that we approach health literacy as a regional health literacy team is seeing it as a universal precaution. An example of a universal precaution is kind of hand soap. So and it's about kind of treating everyone as though they might have that problem, because it's cheaper to assume everybody might have that problem, than to just treat it on a case by case basis. So in healthcare, well, everyone kind of in the world, is potentially covered in invisible bugs, that could be spread to other people, but they're invisible, so we can't see them. So every person who comes into a hospital, whether they are a patient, a family member, a taxi driver, a member of staff, could be carrying these invisible bugs. And some of these bugs are fine. Some of them could be really infectious. And if everybody had them, could cause an outbreak or a pandemic. So, what we do is we encourage people to assume that they have these invisible bugs, and kind of do behaviors that mean that stop them spreading. So we tell people to wash their hands. If staff are kind of doing operations, they'll wear face masks and gloves. And that's because the cost of paying for hand soap and masks and gloves is a lot cheaper than the cost of having to deal with the pandemic, if these invisible bugs spread. So we assume that everybody potentially has a dangerous disease, and we do these kind of a lot cheaper, really simple things, to make sure that it doesn't spread. Now, health literacy isn't an infectious disease, but it is invisible, and we can't tell just by looking at somebody what their health literacy level is. But we do know that every other person walking into our hospitals will struggle to understand health information because we've got that statistic of 62% of people. And if we knew that 62% of people, every other person coming into hospital, might have an infectious disease, we'd be doing something about it. We'd be taking precautions. That's what we need to do with health literacy. So we need to treat everybody as though they will struggle to understand health information. And then when we give them health information and explain it, we pitch it at a level that everybody could understand. So at that lower level. Um, so that is the approach that we take. So we don't kind of say, oh, what's your reading level? I'll give you this information written at this reading age. We pitch it at kind of like the reading age that those people with low health literacy or with the lowest health literacy could understand. Going back to those ways to make kind of those ways that we share information, I've now added some kind of tips for how to kind of make that type of information easier to understand. Some of them are techniques. Yeah, some of them are kind of behaviors. So with speaking, we recommend you use kind of two different techniques, but use them together. So we use chunk and check and teach back. And that's basically when you're giving a lot of information to somebody, and when they need to do something when they go, break the information down. Kind of there are statistics around kind of you only remember kind of half of what you hear in an appointment, and then of that kind of like 50% of information that you have remembered, you only actually remember 50% of that, right? So you forget quite a lot of information. So but if you break information down, it's a lot easier to take on board. So break it down, and then if there's anything that you need people to do once they get home, check their understanding, and to check their understanding, get them to teach it back to you. So you can say things like, so just show me kind of what you're going to do when you get home. The important thing is you're not kind of checking their understanding, you're checking whether you have explained well enough, because we have a duty to explain things in a way that people can understand. And if people don't, we haven't done our job right in explaining things clearly. So you can say things like, just to check that I've explained it well enough. Kind of, what points did you take away? Or, yeah, what are you going to do when you get home? In terms of writing, we say use simple language, kind of simple language, everyday language, the kind of words that I'd say to your friend at the pub. Maybe not all of them, but just really everyday simple language. Don't need to use kind of jargon or corporate language. Just keep it simple and basic as possible. With online information, that simple language still applies because a lot of information that we have online is written. So if you've got a website, make sure it's in everyday language, trying to take out as much kind of jargon as you can. It's really important to kind of not assume that everybody knows how to use digital tools as well. So I'd always recommend to offer people help. So if you've got an online form to fill in or to book things, offer to help people to do that. Because they might be too embarrassed to say, actually, I don't know. You can't always assume that everybody knows how to use kind of digital devices or that everybody has a phone. And with signs and directions, gold standard would be to kind of rename clinics so that they were simpler. So instead of say hematology, you could say like blood services. At a minimum, because I know it's really hard to get signs changed. Just make sure that if you're sending somebody to a certain place, like the letter that you've got kind of refers to that place by the same name. So don't send someone for an X-ray when it's in the radiology department. You're sending someone from an X-ray and the department's called radiology, say in the letter, this is in the radiology department, so people don't get confused. And also, if you can, kind of provide maps, and not ones that are kind of have been photocopied 10 times, and are really blurry and dark, kind of make sure that they're clear and big enough for people to read and understand. And those are really simple things, but they are kind of key to kind of like improving everybody's health and well-being. It's not just us kind of saying these things as well. We do a lot of going out and speaking to local people, the local community. And the things that they've said are that actually kind of doing these things, speaking simply, writing simply, are really key to kind of personalized care. Um, to kind of for people understanding what's happening to them and being able to say, this is what's right for me. It's key to shared decision making. So people feel more empowered to ask questions. And it's also really important for fairness. It's not right that only a certain number of people can understand health information. It's not right that, what's it, only 38%, less than half of people can understand the information that we're giving them when we're the ones that are writing it. So it's really important for us to kind of make these small changes to make kind of care fairer for everyone and improve people's chances. Just to give you a flavour of the kind of things that people have said. So a year or so ago, we went out into the local community and we gave people our original leaflet. So before we'd done any health literacy work to them. And these are the kind of things that they've said. So think back to that question around kind of if half of people are struggling to understand health information, why is that a problem for patients and the public? So they said it was daunting. It sends you into a panic. It would scare me. And that big block of text in the middle, that would stop me from coming back. So thinking about patient experience, people are scared, frightened, panicked, the impact that'll have on staff. And here again, words on a page, meaning that people actually don't get the care that they need. They don't go for the care that they need, which is really kind of sad. What we then did was we gave them leaflets written at a reading age of 9 to 11. So those kind of that 62% of people who might struggle to understand health information, they're going to understand a leaflet written at a reading age of 9 to 11 because that's kind of the average reading age in the UK. So we gave them leaflets written at this reading age, and this is what they said. So they said they sounded more human. They said you get less Raji patients if you gave them this. So I said about kind of people will get stressed and this would be kind of like carry on to staff. So less Raji people. And also speaking more normally means I'm more likely to ask questions. So linking back to that shared decision making. So yeah, it's not just me who's saying this. It's these are local people who really need this information, and these are the kind of things that they said. So thank you very much for watching this bite-sized session. If you want to find out more about what we do or want kind of a training session for your team, feel free to contact us. Our email address is stsft.nenc.healthliteracy@nhs.net. And here are the references of all the different kind of things we talked about in the webinar.